So guys, today we'll be talking about the blockage of superior vena cava below the azygos vein. Okay, that's like after the azygos vein. All right. So now you can see this is the azygos vein. Okay, yeah, this is the azygos vein. All right. So now there's blockage below the azygos vein. Right. So now you guys should calm down. Let me even take it from here. All right. Let me take it back here. So if you are asked this type of question, they simply mean two veins return blood back to the heart. That's the superior vena cava and the inferior vena cava. All right. So now, if there is blockage of the superior vena cava, of course, blood will return back through the inferior vena cava. All right. But what is the pathway? Okay. So now you have to mention all the veins involved in this process. Okay. I got it for you guys here. All right, with the mnemonics for it. The mnemonics is what V about G phi. V about G phi. Alright, just learn how to spell it and you are good. Can you see that it is part of me? Right? This is because I've memorized it many times. Alright, so practice makes perfect. Alright, so don't just come to this video and be like, I just watched it, I didn't understand. Watch it over and over again. Okay, so V about G phi. V about G phi. Alright, so let's have an overview before we come here. So the main question is, a patient has a blockage of the superior vena cava below the azygos vein. Okay, so how will blood return to the heart? Okay, and this is a question based on mediastinal syndromes. Okay, so looking at this, I've already explained this image. You see that your azygos vein is feeding into the superior vena cava above, then there's a blockage below. Okay, so how will blood get back? Okay, how will blood follow back into the inferior vena cava, then back to the heart? Okay, so let's have an overview. When the superior vena cava is obstructed below the opening of the azygos vein, the blood is returned through the inferior vena cava via the femoral vein, and the superior veins are dilated on both the chest and the abdomen up to the saphenous opening in the thigh. Okay, so the superficial vein connecting the lateral thoracic vein with the superior epigastric vein is known as the thoracoepigastric vein. Okay, so this is just like an overview. Okay, but the main stuff, you can see this is like a blockage of the superior vena cava below the azygos vein. Okay, so blood will have to follow this side and back into the inferior vena cava. So what are the names of the veins that blood will have to follow? That's where V-Bout G comes in. Alright, that's the mnemonics. V-Bout G, V-Bout G, V-Bout G. The V stands for, okay, let's just talk about the pathway first. So from vena azygos, blood will go into the brachiocephalic vein, from there to the axillary vein, from there to the lateral thoracic vein, from there to the thoracoepigastric vein, from there to the superficial epigastric vein, from there to the great saphenous vein, from there into the femoral vein, then from there into the inferior vena cava, then back to the heart, okay, via the right atrium. Okay, so now this V Bowers G is like our mnemonics to remember this pathway. The V stands for vena azygos, B stands for brachiocephalic vein, A stands for axillary vein, L stands for lateral thoracic vein, T stands for thoracoepigastric vein, S stands for superficial epigastric vein, G stands for great saphenous vein, F stands for femoral vein, I stands for inferior vena cava, H stands for the heart. Okay, so V bars, G, and good luck in your exams.